Code Blue, OR3, Code Blue, OR3. The announcement echoed through Chicago General Hospital as chaos erupted. The lead surgeon had just suffered a massive heart attack mid-operation, and a 6-year-old girl lay on the table with her skull open. Every available doctor was either in surgery or treating emergencies from a multi-car accident. That's when Maria Santos, the quiet woman who'd been serving coffee for 3 years, walked into that operating room and did the impossible. Welcome to the Human Stories. Before we continue this extraordinary tale of hidden talents and life-changing moments, tell me in the comments, where are you watching from today? And if you believe stories like this need to be told, hit that subscribe button and help us share these incredible journeys. Now, I need you to understand something about hospitals. They're built on hierarchy. Doctors at the top, nurses below them, and everyone else invisible. Maria Santos had been invisible for 3 years. But what happened in OR3 that day would shatter every assumption about who belongs where. And the most shocking part? This wasn't beginner's luck. This was muscle memory from a life everyone thought she'd never lived. Maria Santos clocked in at Chicago General Hospital every morning at 5:30 a.m. She wore the same navy blue uniform, the same comfortable shoes, and carried the same quiet dignity that made her nearly invisible to the medical staff who rushed past her cart every day. For 3 years, she'd been part of the landscape. The woman who refilled coffee dispensers, restocked the pastry case, and wiped down tables in the cafeteria with methodical precision. She knew every doctor's order by heart. Dr. Richards liked his coffee black with 2 sugars. Dr. Chen preferred green tea in the afternoon, and Dr. Martinez always grabbed a blueberry muffin during his 3 p.m. break. To them, she was just Maria. Reliable, quiet, forgettable Maria, who spoke with a slight accent and always smiled when they barely acknowledged her presence. They didn't know her last name, her story, or anything about the life she'd left behind. She was simply part of the machinery that kept the hospital running. But Maria remembered everything. She remembered every conversation she overheard, every medical term that floated past her station, every procedure discussed in hushed tones over coffee. Her mind cataloged it all with the precision of someone who'd once lived and breathed medicine. Here's what none of those doctors knew. The woman serving their coffee had once been Dr. Maria Elena Santos, chief resident of neurosurgery at Johns Hopkins. The woman they barely noticed had published papers that changed surgical protocols. The invisible cafeteria worker had hands that had performed over 500 successful brain surgeries. But that was before everything fell apart. Before she lost everything that mattered and had to disappear into a life where no one would ever think to look for a brilliant surgeon. March 15th started like any other day. Maria arrived before dawn, prepared the coffee machines, and arranged the pastries in neat rows. The morning rush began at 6 a.m., residents grabbing quick breakfast, attending physicians getting their caffeine fix before rounds, nurses stealing 5-minute breaks between shifts. Dr. Elizabeth Harper, chief of neurosurgery, stopped by her usual spot at the counter. She was preparing for a complex procedure, a 6-year-old girl named Sophie Chen who'd been in a car accident. The child had suffered severe brain trauma and needed immediate surgery to relieve pressure from swelling. When Maria asked if she wanted her usual order, Dr. Harper replied distractedly, while studying the tablet in her hands. She mentioned needing extra luck that day because of a tough case in OR3. Maria nodded sympathetically, but her attention had caught on the medical images displayed on the tablet. Even upside down and from 3 feet away, she could see the telltale signs of increased intracranial pressure, the specific pattern of bleeding that would require a delicate approach. The temporal approach would minimize trauma to surrounding tissue, Maria thought automatically, then caught herself. That wasn't her world anymore. What I'm about to tell you next will sound impossible. But sometimes life puts us exactly where we need to be, even when we think we're running from who we used to be. Because while Maria was serving coffee and trying to forget her past, fate was about to drag her back into an operating room. And this time, there would be no choice but to remember everything she'd tried so hard to forget. At 2:15 p.m., the first emergency call came in. Multi-car accident on the interstate, multiple victims en route. By 2 p.m., every available surgeon was either in an operating room or prepping for one. The hospital switched to emergency protocol, all non-essential procedures postponed. Maria watched from the cafeteria as the controlled chaos unfolded. Gurneys rushed past, medical teams moving with practiced efficiency, the familiar dance of trauma response that she'd once been part of. At 2:47, she was wiping down tables when the announcement came over the speakers. Code blue, or 3, code blue, or 3. Her blood ran cold. Or 3 was where Dr. Harper was operating on Sophie Chen. Maria's hand stilled on the table she'd been cleaning. The announcement repeated, calling for all available physicians to OR 3 immediately. But there were no available physicians. They were all dealing with the accident victims. Maria found herself moving before she'd made a conscious decision. She left her cleaning cart and walked toward the elevator, her heart pounding with each step. She shouldn't be going there. She had no business in the surgical wing. But her feet carried her forward anyway. Now here's where this story takes a turn that will give you chills. Because when Maria stepped off that elevator and saw what was happening in OR 3, every instinct she'd spent 3 years suppressing came flooding back. The woman who'd been hiding behind a coffee cart was about to become someone she'd sworn she'd never be again. And there wasn't a single person in that hospital who could stop what was about to happen. The scene in OR 3 was chaos. Dr. Harper lay unconscious on the floor, victim of a sudden cardiac event. The anesthesiologist was performing CPR while trying to monitor Sophie's vitals. The surgical nurses stood frozen, unsure of protocol when the lead surgeon collapsed mid-procedure. 6-year-old Sophie Chen lay on the table, her skull opened, brain exposed, the delicate surgery only half completed. Without immediate intervention, she would die within minutes. One of the nurses frantically said they needed another neurosurgeon and suggested paging Dr. Martinez. Another replied that he was in OR 5 with a trauma case, and Dr. Rodriguez was in OR 2. Everyone was busy. Maria stood in the doorway, invisible in her navy blue uniform. No one noticed her. No one thought to question why a cafeteria worker was in a sterile surgical environment. She looked at Sophie's exposed brain, at the monitoring equipment, at the surgical instruments laid out with precision. Her hands tingled with muscle memory. When Maria quietly asked how long the patient had been open, the anesthesiologist looked up, startled. He told her she shouldn't be in there, but when she repeated her question with more urgency, he automatically replied that it had been 23 minutes, then caught himself and insisted she needed to leave because it was a sterile environment. Maria studied the monitors, the brain tissue, the positioning. She could see exactly what needed to be done. The procedure Dr. Harper had started was textbook, a standard craniotomy to relieve pressure. But there were complications, bleeding that needed to be controlled, pressure that needed to be relieved in the next few minutes, or Sophie would suffer permanent brain damage. What happened next will challenge everything you think you know about expertise, about judgment, about who gets to make life and death decisions. Because Maria was about to cross a line that couldn't be uncrossed. She was about to reveal who she really was. And in doing so, she was about to save a life that every protocol said she had no right to touch. Maria told everyone to step aside and move to the scrub sink. When the surgical nurse protested that she couldn't be there, Maria began scrubbing in with the practice efficiency of someone who'd done it thousands of times. She calmly explained that Sophie's ICP was rising, visible on the monitor, that the temporal lobe was swelling and there was active bleeding from the middle meningeal artery. Without immediate intervention, she stated, the child would herniate within the next 5 minutes. The room fell silent except for the steady beeping of monitors. When the anesthesiologist asked how she knew that, Maria pulled on surgical gloves with fluid precision. She explained that she'd seen it before, many times. She approached the table, her eyes never leaving Sophie's exposed brain. She told them that Sophie needed immediate pressure relief and cauterization of the bleeding vessel. The procedure Dr. Harper had started was correct, but she hadn't accounted for the arterial damage visible on the pre-op CT. When the nurse stated that she wasn't a doctor, Maria picked up the cautery tool, testing its function with the unconscious competence of someone for whom these instruments were extensions of her own hands. She replied quietly that, no, she wasn't a doctor anymore, as she positioned herself at the table. I want you to understand what was happening in that moment. Maria Santos wasn't just performing surgery, she was reclaiming an identity she'd buried. She was choosing to save a life even though it meant exposing herself, even though it meant everyone would know she'd been lying for 3 years. But sometimes, being true to who you are matters more than being safe. And sometimes the person you used to be is exactly who the world needs you to be. Maria's hands moved with surgical precision, each movement deliberate and controlled. She located the bleeding vessel, carefully cauterized it, then began the delicate process of relieving the pressure on Sophie's brain. The surgical team watched in stunned silence as the cafeteria worker performed complex neurosurgery with the skill of a master surgeon. Her technique was flawless, her knowledge encyclopedic, her confidence absolute. When she requested suction, the nurse automatically complied. The anesthesiologist reported that ICP was dropping, his voice filled with amazement. Maria worked for 45 minutes, repairing damage, ensuring proper drainage, and carefully monitoring every aspect of Sophie's brain function. When she finally stepped back from the table, Sophie's vitals had stabilized. The pressure in her skull had normalized, and her brain function showed no signs of permanent damage. She asked the nurse to close for her, and the nurse stared at her with a mixture of awe and confusion. When the nurse stammered that she didn't understand who Maria was, Maria pulled off her surgical gloves and looked at Sophie's peaceful face on the table. She replied quietly that she was someone who used to save lives before she learned that sometimes saving lives isn't enough. But saving Sophie was just the beginning. Because word of what happened in OR3 was about to spread through Chicago General like wildfire. The hospital administration was going to demand answers, the medical board was going to ask questions, and Maria was going to have to decide whether to run again or finally face the truth about why a brilliant neurosurgeon had spent 3 years hiding behind a coffee cart. Within an hour, Dr. Elizabeth Harper had been stabilized and transferred to the cardiac unit. Sophie Chin was in recovery, her surgery successful, her prognosis excellent, and Maria Santos was sitting in the hospital administrator's office, still wearing her cafeteria uniform, facing questions she'd hoped never to answer again. Administrator Patricia Wells read from the computer screen, stating Maria's full credentials. She identified her as Dr. Maria Elena Santos from Johns Hopkins, magna cum laude graduate, chief resident of neurosurgery, published researcher, licensed in Maryland but suspended in Illinois 3 years ago, pending investigation. Maria sat silently, her hands folded in her lap. Wells continued, explaining that Maria had been working there under false pretenses. No medical credentials listed, no mention of surgical background. She'd been serving coffee while qualified to perform brain surgery. When Maria quietly replied that she wasn't qualified anymore, Wells consulted her files. She revealed that medical board records showed Maria had been investigated for a surgical error that resulted in patient death. Charges were never filed, but her medical license was suspended pending review. Maria closed her eyes. Even after 3 years, the memory still felt like a physical blow. When Wells asked what happened, her tone became softer. Now I need to tell you about the day that changed everything for Maria. The day that turned a brilliant surgeon into a woman hiding behind a coffee cart. Because understanding her past is the only way to understand why what she did today was about more than just saving Sophie. It was about forgiving herself for the one time her skills weren't enough. Maria took a deep breath before speaking. She explained that the patient's name was David Morales, 8 years old, same age as Sophie, brain tumor, supposedly inoperable. She had spent weeks studying his case, developing a new approach. She was convinced she could save him. She paused, the memory still raw after all these years. She described how the surgery lasted 14 hours. Everything went perfectly. She removed the entire tumor with no apparent damage to surrounding tissue. David woke up talking, laughing, normal. For 3 days, it looked like a miracle. Wells waited, sensing the rest of the story. Maria continued, explaining that on the 4th day, David started seizing. They couldn't control them. He died that night. The autopsy showed she'd caused microscopic damage to a critical area during the tumor removal. Damage so small it didn't show up on any scan, but enough to cause fatal complications. When Wells observed that it was one mistake, Maria replied that it was one mistake that killed a child. David's parents had trusted her completely. They believed she could save their son when no one else would try, and she killed him. Maria looked up, meeting Wells' eyes for the first time. She explained that the medical board cleared her eventually. They said it was an acceptable risk, that David would have died anyway without the surgery. But she knew the truth. She'd been arrogant, overconfident. She thought she was better than she was. When Wells stated that she had disappeared, Maria confirmed it. She explained that she couldn't hold a scalpel without seeing David's face. She couldn't walk into an OR without remembering his parents' trust and how she'd betrayed it. She lost her nerve, her confidence, everything that made her a surgeon. But here's what Maria didn't know. While she'd been running from her past, her work had been saving lives all over the world. The surgical technique she'd developed for David's case had been refined by other surgeons and had saved dozens of children with similar tumors. Her failure had led to someone else's success. And today, all those years of hiding were about to lead to the most important conversation of her life. Administrator Wells leaned back in her chair, studying Maria with new understanding. She asked if Maria was aware that the technique she'd developed for the Morales case had become standard protocol for pediatric brain tumor removal. Maria looked up, surprised, and asked what she meant. Wells explained that Dr. James Mitchell at Boston Children's had published a paper 2 years ago refining Maria's approach. It had saved 37 children to date. Maria's surgical notes from the Morales case were instrumental in developing the current protocol. Maria sat in stunned silence. Wells continued, pointing out that Maria's mistake had led to innovations that had saved more lives than most surgeons save in their entire careers. When Maria whispered that David still died, Wells acknowledged this truth. She said it was a tragedy Maria would carry forever. But the question now was what she would do with the gift she'd been given. Would she keep hiding, or would she use her skills to honor his memory? Wells pulled up Sophie's post-operative scans on her computer. She explained that this little girl was alive because Maria remembered who she was. Her parents would get to take her home because Maria chose to act despite her fear. Maria stared at the scans, seeing the precise work she'd performed, the life she'd saved. Wells stated that she couldn't promise Maria would never lose another patient. No surgeon could. But she could promise that hiding talents didn't honor the ones they lost. It dishonored them. What happened next would determine not just Maria's future, but the future of every patient she might save. Because sometimes redemption isn't about forgetting your failures. Sometimes it's about learning to carry them while still having the courage to try again. And sometimes The person you used to be is exactly who you need to become again. 3 months later, Dr. Maria Santos walked through the halls of Chicago General in surgical scrubs instead of a cafeteria uniform. The Illinois Medical Board had reinstated her license after reviewing her case and recognizing the circumstances of her 3-year absence. She'd agreed to start slowly, assisting in surgeries, rebuilding her confidence, working under the supervision of Dr. Harper, who had recovered fully from her cardiac event and insisted on mentoring the woman who'd saved her patient. When Dr. Harper asked if she was ready for her first official surgery back as they scrubbed in together, Maria nodded, though her hands trembled slightly as she pulled on her gloves. She replied that she was as ready as she'd ever be. The patient was a teenager with a head injury from a skateboarding accident. Routine surgery for someone of Maria's skill level, but still her first time as primary surgeon in over 3 years. As they entered the OR, Maria caught sight of a familiar face in the observation gallery. Sophie Chen, now 8 years old and fully recovered, was there with her parents for a routine follow-up. The little girl waved when she saw Maria, pressing her face to the glass with a huge smile. Dr. Harper observed that Sophie was Maria's biggest fan. Maria smiled back at Sophie, feeling something she hadn't experienced in years. The pure joy of using her skills to heal. Not the terror of potential failure, not the weight of past mistakes, but the simple satisfaction of being exactly who she was meant to be. When the anesthesiologist called that the patient was ready, Maria approached the table, her hands steady now, her mind clear. She looked at the young patient's face, then at the monitors, then at the team assembled around her. She announced that they should begin. 2 hours later, the surgery was complete. Perfect execution, no complications, another life preserved. As Maria stepped out of the OR, she found Sophie and her parents waiting in the hallway. Sophie called out excitedly and ran to hug her legs. Her mother had told her that Maria was the one who fixed her brain. Maria knelt down to Sophie's level, seeing in the child's bright eyes the reason she'd become a surgeon in the first place. She told Sophie they had fixed it together and that Sophie had been very brave. Sophie's mother approached with tears in her eyes. She said they could never thank Maria enough. The doctors had told them what she did, how she saved Sophie when everyone else was busy. Maria replied that she was just doing what needed to be done. Sophie's father stated firmly that she wasn't just doing what needed to be done. She was being who she was meant to be, and they were grateful she remembered. As the Chen family walked away, Dr. Harper joined Maria in the hallway. She asked how it felt. Maria watched Sophie skip down the corridor, chattering excitedly to her parents about the surgery she'd just observed. She replied that it felt like coming home. Dr. Harper said that was good, because she had 6 more cases lined up for Maria that week. Chicago General was lucky to have her back. Maria smiled, feeling for the first time in 3 years that she truly belonged somewhere. She thought about David Morales, carrying his memory not as a burden, but as a reminder of the responsibility that came with her skills. She thought about the 37 children who had been saved using techniques born from her failure. Most of all, she thought about Sophie, alive and laughing because Maria had chosen to remember who she really was when it mattered most. The cafeteria would have a new coffee person tomorrow, but Chicago General had gotten back something far more valuable. A surgeon who understood that healing others sometimes meant healing yourself first. The invisible woman who'd served coffee for 3 years was invisible no more. Dr. Maria Santos was exactly where she belonged, saving lives and honoring the memory of those she couldn't save by refusing to waste the gift she'd been given. Sometimes the most important journey isn't about becoming someone new. Sometimes it's about remembering who you always were and finding the courage to be that person again. Despite your fears, despite your failures, despite everything that tells you to stay hidden. Maria had learned that redemption wasn't about erasing the past. It was about carrying it forward and using it to do better tomorrow than you did yesterday. So now I ask you, how many talented people are hiding their gifts because they're afraid of failing again? How many potential healers, teachers, leaders, and innovators are serving coffee when they could be changing the world? Share your thoughts in the comments, because here at the Human Stories, we believe that everyone deserves a second chance to be who they're meant to be. If this story moved you, please hit that like button to help us reach more people who need to hear these stories of resilience and redemption. Subscribe to the Human Stories and ring that notification bell so you never miss our daily videos about the extraordinary people finding the courage to try again. We share a new inspiring story every single day. Your support means everything to us. Every like, every comment, every share helps us grow this community of people who believe in second chances, hidden talents, and the power of choosing courage over fear. Thank you for being part of our journey, and remember, sometimes the most important skill you have isn't what's on your resume. It's the courage to use your gifts when they're needed most, regardless of how long you've been hiding them. We'll see you tomorrow with another incredible story, where we continue to celebrate the strength it takes to remember who you really are.